to turn now to Hugh Pym, the BBC. Hugh.
Thank you. Online booking for virus testing has clearly proved very popular. Thousands of workers got the slots they wanted or managed to book kits. Others may well have been disappointed. What assurances can you give about future demand being met, and how much will capacity go up over the next few days?
Hugh, thanks very much. I can tell you actually that there were reports that the website had crashed, which it hadn't. It was simply that the slots for today were taken up. We've seen, haven't we, in the last few days, this difference between the capacity available, I think the last figure I saw was 51,000, and the number of tests done, 28,000 yesterday, and how important it is to make sure we're using that available capacity. People being able to book online directly, that's all the critical workers, 10.72 million people with their families, are those who are available now to use that site. I can tell you also that 16,000 of those were booked during the first period of that being online. And the site has actually been brought back up around now for more people to go and book sites. It will then close off again. More tests will become available tomorrow, and so on. So the answer is, as we heard from Professor Newton standing here yesterday, it looks like the trajectory to 100,000 tests by the end of April is going to be met in terms of capacity. I would say after the experience today, it looks like the demand is there, and if those two things come together, of course, then we will have that 100,000 tests per day ambition met. So that's the status of the situation. One more thing to add is that we have heard from the devolved administrations who also now want to join in using that online booking system as well. Did you want to come back, Hugh?
No, just to say, obviously, you don't want people's expectations to be disappointed. Just to sum up, are you pretty confident that you can meet the demand that is out there, certainly in the next week or so?
I think it's fair to say that so no one, of course, quite knows. But we know what the capacity is. We don't quite know how many people would want to be tested, because many people working for the NHS, for example, will have already accessed those tests through their workplaces. This is now a much wider number of people, key workers, critical workers, including, for example, the transport workers that I was talking about in my comments, and we don't know the answer to how many that will be. I do know, and it is worth stressing to people when they go to that site, that this is a test which will only test if you currently have coronavirus. So there's no point to go on there and test to see if you had it 3 weeks ago. It's not going to give you the answer to that question. So it's a current day thing. We'll see how it settles down, but we're encouraged by those 16,000 bookings online. Indeed, 46,000 people went to the portal first thing today. There's some more slots opening up right now as I'm speaking, and there'll be more slots tomorrow and days after.
And perhaps, if necessary, to encourage the police, rather than to police by consent, to go back to a different way of policing as they did at the beginning. I wonder what your thoughts were.
Look, I think overall, I mean, it's tragic to hear stories like that, and I think overall the country's done incredibly well in adhering to social distancing. And there is a danger as we go into yet another warm, sunny weekend that people think that perhaps these graphs are showing that the peak is over. But as Jenny was very clearly showing, and I'll ask her to comment in a moment, it isn't over. We're riding perhaps we hope a downward trend, but it's by no means established yet. And when people ask me, when will the measures, the social distancing, the stay-at-home measures be altered? My answer in some ways is some of this lies in your own hands. The more we adhere to it and are strict about the social distancing that's required, the faster that decision will be able to be made. But that decision, of course, will be made entirely on the advice of science and medical advice. Jenny, can I turn to you?
Yes. So I think, the story you provide is often a very powerful one. People who have lost relatives or loved ones or colleagues at work really feel when they see people flouting the social distancing requirements, and it is absolutely critical that we maintain them. It does, of course, demonstrate why, although this is a very science-led approach, that science includes behavioural science. and right at the start of the advice that was given, there was a